Good evening. I'm psychiatrist Jay Fauver, and welcome to Matters of the Mind. Matters of the Mind is a weekly mental health program where you get to choose the topic for discussion. So if you have any questions concerning mental health issues, you may email me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with an email I recently received. It reads, Dear Dr. Fauver, how does psilocybin help with depression? Psilocybin is a hallucinogenic from mushrooms, and psilocybin's been around for a long time as a hallucinogenic substance, often used by the American Indians over the course of the years. And psilocybin is a medication that will stimulate serotonin 2A receptors. And if you think about what serotonin 2A receptors will do, serotonin 2A receptors will basically wake up the brain, which is stuck in the so-called default mode of networking. So when we think about how the brain works, you've got a default mode of the brain where, you're just kind of daydreaming, you're not thinking about anything in particular, your mind is just kind of wandering, you're not really focusing on anything that requires a lot of attention. Well, default mode network is manifested by this lower part of the brain, and it gets stuck when you get depressed. The default mode to go into the executive mode, the thinking part of the brain, it needs a clutch. So if you remember the old days when we had manual transmission on automobiles, you'd have, first gear, second gear, third gear, and you needed to press the clutch to be able to take them from one gear to another. Well, psilocybin will basically lubricate that clutch and allow you to get out of the default mode where you're stuck with depression and be able to get into the thinking mood. The clutch is the salient network, and then the executive mode network is the thinking part of the brain, and that's the outside part of the brain. So what you're trying to do with psilocybin is jolt the brain out of this default mode and get it into the thinking mode where you can think more clearly. And part of the problem with depression is you can't think clearly enough to be able to cope with everyday circumstances. Now, we all go through stressful events in our lives. We all go through difficulty with various circumstances in life. We got to be able to cope with that based on our past experiences, based on our past coping abilities, based on our understanding that things can work out, and so that we don't get overwhelmed with these different things. So with the use of psilocybin, what you're trying to do is jump that brain into the executive mode network where you can think more clearly overall. Thanks for your email. Let's go to our next email question. And our next email question, is, Dear Dr. Fauver, I'd like to quit smoking. Is vaping a good bridge to quitting? I know a lot of former smokers who have gone to vaping. Vaping is maybe a bridge. I remember, my goodness, when I first started hearing about the concept of vaping about 30 years ago, I thought, this would be a nice alternative to smoking because you're not getting all the extra chemicals with tobacco cigarettes. So it made sense that vaping could be a tool. However, over the course of the years, the pulmonary doctors told us that the vaping device had some toxic chemicals in them that are like plastic. And so if you think about liquid plastic, that plastic is coating the lungs. So we often would hear about people who are getting all these pulmonary conditions, not unlike what we'd hear with tobacco cigarettes, but yet a bit different, because basically when you think about vaping on a regular basis, you're not getting all the extra chemicals that you might be getting from tobacco cigarettes, but you might be getting some plastics, some liquid plastics going into the brain and coating the lungs themselves. So that could be the problem with that. Now, when I talk to people about quitting cigarettes, I'm always talking about a way of stepping away from the nicotine. Nicotine withdrawal isn't very pretty. It can go on for typically several days where it's problematic, and it can cause people to have a lot of irritability, insomnia, they can have nightmares, a lot of difficulty with withdrawing from nicotine. When you withdraw from nicotine, basically what's happening, nicotine previously went to this middle part of the brain called the nucleus accumbens, and the nucleus accumbens will spray out dopamine. It makes you feel really good. Nicotine will stimulate the nucleus accumbens to spray out its dopamine, and you feel good, you feel relaxed, you feel more focused. So it does a lot of things that can help you in various ways, but the problem is to be able to achieve that same degree of happiness and enlightenment, so to speak, you have to have a higher amount of nicotine over the course of time. And that's why people will often smoke more and more and more as time goes on. So the idea with getting off of nicotine is to use a lesser and lesser amount. Now, there's ways to do that. There's a medication called Chantix. It's been around for 25 years. Chantix will mimic the effect of nicotine in the nucleus accumbens on the nicotine receptor, and in doing so, it makes your brain kind of think it's getting a little bit of nicotine. It'll spray out about 30% of the dopamine that nicotine would. So it sprays out a little bit of dopamine, but yet not so much that it's addictive for you. And not uncommonly, we will add a little bit of Wellbutrin. Bupropion is an antidepressant medication. It's been around since 1989. We'll add a little bit of Wellbutrin as a means of helping give you a little bit extra dopamine transmission. Wellbutrin is a non-addicting antidepressant medication that, as its mechanism, will increase transmission of dopamine and norepinephrine, so it can kind of offset some of the difficulties you can have in coming off of nicotine itself. So the combination of Chantix with Wellbutrin can double your likelihood of staying off of nicotine compared to just using Chantix alone. So we'll often use that combination. Sometimes we'll use at bedtime a really small amount of a medication called Doxepin. Doxepin can be used as a means of decreasing nausea, decreasing nightmares, and helping with sleep. And we often hear about people going through nicotine withdrawals, having nausea, nightmares, and difficulty of sleep. A little bit of Doxepin at bedtime can help with that for a lot of people. So pharmacologically, we're using these different techniques to help people get off the nicotine itself, to offset the rebound effect of the excessive dopamine that they had gotten while they were using nicotine. Now it's coming down, so they have a more nicotine withdrawal in that way. We will often have people use patches. We'll have them use nicotine gum, which is tricky to use because with nicotine gum, it's not like regular gum where you want to just chew, 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 chew and swallow, chew and swallow, chew and swallow. You want to be able to hold the saliva after you chew the nicotine gum, and you want to hold the saliva in your mouth because the nicotine needs to get absorbed in your gums themselves. So with the use of the nicotine gum, it's a little bit different means of chewing compared to regular gum, but that yet is another way to try to get off the nicotine itself. Would I advise somebody to use a vape? You got to be so careful in doing it, but it can be done where you're using a lesser and lesser dose with nicotine vaping. But you got to keep in mind that vaping is awfully easy to do. Vaping can give you that strong delivery of nicotine to the lungs, just like tobacco cigarettes can. So you got to be careful with that. And that's why we'll often do the nicotine withdrawal in a medically supervised kind of strategy where we'll use a protocol to help people get off nicotine. Thanks for your email. Let's go to our next text. And there's the next text. We got a text from David in Huntington. Hello, David. You want to know, how does a GLP-1 or does a GLP-1 cause depression? A GLP is glucagon-like peptide, GLP. People know him as GLP-1. Semaglutide, Ozempic is a trade name. It's very popular, Mounjaro. These are medications that have been around for several years now, and you're seeing a whole bunch of them come out, little bitty injections to the belly. We're seeing tablets come out that you take on a daily basis even. So we're hearing a lot about GLP-1s. What do they do? GLP-1s basically will change the gut motility to make you feel full. And secondly, it'll actually change the way that your body processes glucose. So a GLP-1 can help you lose weight and control your blood sugar fairly dramatically. Now, the drawback that we always see with GLP-1s, I gotta say it, you can lose muscle mass. And that's something there was a study out of Illinois recently that talked about people who were on GLP-1s for weight control and type 2 diabetes, and they actually had less physical activity despite losing weight. And that seems like a contradiction. It seems like if you lost weight, you'd feel like you'd want to be more physically active, but they weren't. They were less physically active based on fitness bands where they monitored their steps. So in terms of their step work, at least, they were less physically active. I strongly encourage anybody for whom I see on a GLP-1, not necessarily that we've prescribed it, but if we see something on GLP-1, we strongly advise people to lift weights, do resistance training. People in their 40s and 50s will say, well, gee, I haven't done any resistance training since I was in high school. Okay, now's a good time to start because you want to be able to retain the muscle mass you might lose with the GLP-1. GLP-1s will go to the brain. The brain is studded with these little GLP receptors, and it can give you a good effect. Now, the main psychiatric advantage we've seen with GLP-1 medications will be alcohol use disorder and perhaps opiate use disorder, because it'll decrease the craving for extraneous substances. People who have food addictions, people who have binge eating disorder, probably can benefit from GLP-1s because they'll notice the food noise just decreases. So it'll make them less hungry, not only from a brain standpoint, but also in their gut. So eating disorders, binge eating especially, alcohol use, probably opiate use disorders can be helpful. We're hearing that there might be ways that a GLP-1 can help with depressive disorders. Do GLP-1s cause depression? If they do, what sometimes will happen is they make people not enjoy things so much. It's a slippery slope, because part of depression is where you have this symptom called anhedonia. An means no, hedonia means fun. So people with depression, as a symptom of depression, will have anhedonia where they don't enjoy things. I saw a lady a few hours ago who had difficulty with just enjoying anything. And she was just so frustrated because as she had been depressed for many, many years, she just couldn't enjoy things like she used to enjoy. So we're trying to address her ability to enjoy things. A GLP-1, yeah, it can help in that matter, because it's thought that theoretically a GLP-1 can go to your brain. We've got 80 billion neurons in our brain. So think of this brain as having 80 billion neurons in it. Each individual neuron is surrounded by about 10 glial cells. Glial in Greek means glue-like. So you got 10 of these cells that surround the neurons very much like a pit crew would around an Indy car. So think about the Indy cars not with the 7 pit crew members. And with the 7 pit crew members, they can change all 4 tires and give you a full load of gas in 7 seconds, and you're off and running. Okay, they got to be functioning very, very well, those 7 pit crew members. In the same way, glial cells that surround each individual neuron have to be functioning really well. And if they aren't, there could be a lot of problems with transmission of chemicals in your brain. A way that can be problematic will be if the glial cells get inflamed. If the glial cells exhibit inflammation from chronic stress, maybe from other medical conditions. Insomnia can lead to inflammation in the brain. So if you have various factors that cause inflammation in the brain, well, these glial cells will release inflammatory proteins like interleukin-6, tumor necrosis factor alpha, all these terms for inflammatory proteins, and that can thereby cause difficulty enjoying things. So the inflammation of the glial cells can cause you to have difficulty with enjoying things. GLP-1 agonists, to which you're referring for type 2 diabetes, for weight management, GLP-1 agonists can actually decrease inflammation in the glial cells very specifically. Well, that means that maybe they could be used for depression. And in the future, I would predict that maybe 5 to 10 years from now, we're going to be talking about GLP-1 medications for such neurodegenerative conditions as Alzheimer's, dementia, maybe Parkinson's, various neurological conditions of the brain that might be associated with inflammation. So it'll be an exciting time for us. We've often heard about type 3 diabetes. Type 3 diabetes often is alluding to Alzheimer's dementia, because it's thought that Alzheimer's dementia is provoked by inflammation that can be due to excessively high blood glucoses over the course of time. So you've got type 1 diabetes, you've got type 2 diabetes. Type 3 diabetes can actually be something that contributes to brain conditions due to excessive elevations of glucose in the brain on a day-to-day basis. And maybe GLP-1 agonists can be something that can prevent some of that too. So we're closely watching the GLP-1 agonists. I know some psychiatrists around the country right now are strongly advocating it. Do I have any apprehensions? I think that we need to watch for any after effects of GLP-1s, any long-term problems. And I think something that strongly needs to be mentioned is, okay, we got to do something about the loss of muscle tissue, because as all of us get older, we tend to lose more muscle mass, especially after the age of 35 years old. So how do you regain that muscle mass? By golly, I think you need to do resistance training. Should we start taking, under doctor supervision, creatine supplements, not creatinine, creatine supplements, because creatine supplements can potentially not only help with muscle development, but also potentially help with energy in the brain itself. So creatine, 5 grams a day, typically is what's recommended for a lot of people. Should those people be who are on GLP-1 agonists, should they also be taking creatine? We don't know about that, but they should certainly be lifting weights. And that was the recommendation that came out of this study out of Illinois that talked about people getting less and less physically active once they were on a GLP agonist. Was that because they were content with losing weight without having to really put any work into it? Or was it because they had lost weight in their lifestyle previously when they were overweight? Their lifestyle was that they didn't do a whole lot, and they feel better when they lose weight. Yeah, when you lose 50, 60 pounds of adipose tissue, you're going to feel better, but at the same time, you got to do something with that and keep yourself physically active. And resistance training and weight training can be particularly helpful for people. Thanks for your text. Let's go to our next email question. Our next email question reads, Dear Dr. Fauver, is it really true that if stresses don't kill you, it can make you stronger? They can make you stronger. That is a paraphrase of a quote from Friedrich Nietzsche. He was a philosopher about 150 years ago. He was a German philosopher, and he's an atheist, and he thought God was dead and all these things were going to happen because God was dead. Okay, he had it wrong in a lot of ways, but I think he had it right when he talked about stressful events making you stronger if they don't kill you. Because the concept there is, okay, anybody who's been an athlete, they've had a coach tell them this at some point, because coaches will tell you to work harder, work harder, work harder. And what the coaches were saying is if it doesn't kill you, it's going to make you stronger. And they're talking about your physical strength, your endurance, training to the point of almost collapsing. Okay, that can make you stronger in the long run. I think from a neurocognitive standpoint, we talk about this concept of neuroplasticity. And in the brain, as I mentioned, there's 80 billion neurons. Each individual neuron has between 30,000 and 50,000 individual branches. So there's this extensive networking that's occurring in the brain itself. And with that extensive networking in the brain, the branches start to shrivel up when you get under unmitigated stress, when you're not able to cope, when you're just struggling day by day by day to be able to get by because you're on unfamiliar territory and you're feeling overwhelmed. Now, if you've not learned to cope with those situations, it can be overwhelming for you, and that's where inflammation rises. Inflammation in the brain, not a good thing, as I'd mentioned earlier. So what we're trying to do here is we're trying to enhance the branching of the individual neurons. If you enhance the branching of individual neurons, you can cope with things better and you can think through your difficulties in a much more effective way. So how do we do that? Well, there's ways that you can increase the individual branching of your neurons. Think of that individual branching being like fertilizing a tree. The neurons look just like trees, where trees will have the branches above ground. They'll have the trunk, which is like the cell body of a neuron. And then you have the roots underneath, which are like the dendrites in the neuron. So a branched tree looks like a neuron, and if you think about that tree, it's supposed to have 40 or 50,000 branches. Just think of that tree shriveling up over the course of time. What would you do with the tree? You'd fertilize it, you'd water it. That's what we're doing with neurons. So how do you fertilize a neuron? Number one, goes back to exercise again. Aerobic exercise, resistance training, any kind of exercise can enhance the natural fertilization of the brain. It's called brain-derived neurotrophic factor. There's also another natural fertilizer called mammalian target rapamycin, mTOR. So there's different fertilizers in the brain that will help enhance the branching. That's a good thing. Another thing that will enhance the branching will, quite frankly, be embracing challenging situations. Don't run from them. Don't blame somebody else for these challenging situations. Embrace them and do something about them. When you take on those challenges, it actually enhances the branching of your brain, and you're able to learn more, you're able to cope, and you're actually physically, spiritually, and emotionally stronger when you've overcome a stressful circumstance. Now, you got to be careful. This is where Nietzsche talked about if it doesn't kill you. You don't want to be overwhelmed with stress. You're particularly prone to having difficulty with stress when you're under 8 years of age. So if you're under 8 years of age and you have horrific stresses going on in your life, you've got a parent who is mentally ill, you've got a parent who's using alcohol, you've got a parent with mental illness, a parent's in jail, you're getting emotionally, physically, sexually abused, you've been abandoned as a child. These are some of the factors that we'll explore in a questionnaire called the Adverse Childhood Experience Scale. It's called ACEs. It's not copyrighted, available online. But if you've had over 4 of those stresses occur in your young childhood, especially before the age of 8 years old, that's when your brain is very sensitive to development. You can be hardwired if you've had over 4 of those stresses based on research. You can be hardwired to be more likely suffering from anxiety or depression as you get older. So we'll ask people about the ACEs, not because, well, we can do anything about the past. It's just that we want to know, will that person be more prone to having anxiety and depression? And there's a predictor in terms of treatment. If you've had over 4 of those traumatic experiences as a child, you're less likely to respond, to depression at least, to a medication that's increasing serotonin, such as Lexapro, Celexa, Prozac, Zoloft, Paxil, Luvox. These are medications that can be used for depression, and they're not going to work so well for a lot of people who've had over 4 of those particular childhood experiences that were very stressful and traumatic. And if you pair that predictability with genetic testing is not deterministic, it's probabilistic. And what that means is it's not going to tell us exactly what we should do based on genetics, but it'll just kind of tip the scales one way or another on what direction we should go with our treatment. So if we hear about somebody who's endured over 4 of those particular childhood experience stresses, if we know that they have genetic testing that has this particular gene called SLC6A4, which is the serotonin transporter gene, if it's short, those people with people who have been traumatized in early childhood are less likely to respond to the serotonin medications. We kind of put that together in a lot of different ways. Now, if you've been overwhelmed in past traumatization, that can often cause a condition called post-traumatic stress disorder. PTSD is a condition where you're jumpy, you're hypervigilant, you're always expecting something bad to happen. And a bad way to treat post-traumatic stress disorder, even though it sounds like it'd be a good idea, a bad way to treat it is using a medication. It's called a benzodiazepine. We often hear about benzodiazepines such as Xanax, Klonopin, Ativan, Valium. Those medications will calm the brain down, and that sounds like a reasonable strategy, but the problem is they will actually hinder your ability to learn extinction of past bad memories. Now, we should be able to learn and get past bad memories and not think about them every moment of the waking hour. And when something traumatic has happened to you in the past, it should be in the back of your mind. You should be aware of it, that it happened, and be on guard in similar situations. But my goodness, just going through your day-to-day activities, you shouldn't feel like you're on the verge of being traumatized as you had been in the past. And that's called extinction learning. Benzodiazepine medications will actually inhibit extinction learning and unfortunately keep those kind of thoughts on your mind long term. So if we use benzodiazepines for people who have been traumatized, we want to use them very short term and not long term, as we'll often see them used. So with that in mind, what we're often trying to do is give people medications that will actually enhance the fluffiness of their brains. Exercise, as I mentioned, will do it. If you are learning coping techniques, that can help with learning and enhancing the branching of the neurons themselves. But medications can potentially enhance the brain fertilization effect such that you can increase the branching, and that can sometimes occur with some medications like ketamine, esketamine. We now have a medication called Auvelity. Those medications can sometimes get people feeling a lot better very quickly within as soon as a week. And what they're doing is they're directly going to the natural brain fertilizers and enhancing the fluffiness of the brain itself. So with that being said, thanks for your email. Let's go to our next caller. Hello, Tom. Welcome to Matters of the Mind. Tom, you want to know about psychiatric, I'm not sure do psychiatric physicians live longer than the average person? Physicians in general, my understanding is with life insurance adjusters will say that physicians in general will live longer typically. Psychiatrists, can't say. I haven't heard that one way or another. I will say that psychiatrists have a very high divorce rate. We're not going to get into that on this program, but psychiatrists do have a high divorce rate for various reasons. So in terms of living longer, yeah, physicians in general, medical doctors in general will tend to take care of themselves a little bit better, and we tend to be awful patients because when we're advised to do different things, doctors and nurses often don't take medical advice very well because, number one, we're often in denial of our own mental health conditions, and we're often prone to want to do it our way and look beyond what the advice might be given us. So we're not really good patients either. So that's a good question. Let's go to our next text. Well, let's read off what our next text is. Here we go. Can psilocybin, this is from Daryl from Ossian, can psilocybin reduce serious dementia? I haven't heard that yet, Daryl, but I wouldn't put it past that possibility. Dementia is a condition, as I mentioned before. It's also known as type 3 diabetes, and it can be contributed to high blood glucoses and inflammation. I'm not hearing that psilocybin is decreasing inflammation. Again, it jolts the brain out of depression by basically fixing that clutch that allows you to go from the default mode in the executive mode network and allow you to think and having clearer thoughts. But I'm not hearing that it's helping with dementia, but hey, ask me in 5 years, we might be in a whole different place by that time in terms of how we assess that. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Faulver, and you've been watching Matters of the Mind on PBS. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne is made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.